Nurses are on strike. People are dying. And what the health minister had to say is that he's calling upon retired nurses to come and help. Is that the solution? No.
Government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse.
For real, when this thing started, yeah, in case you didn't know, the strike started on June 2nd. When this thing started, I was like, oh, they are going to fix this because GM is trying to, put the nation in order. He's trying to put everything in order. And when they were coming to read the budgets, they were like, even Atoforsin, he was on Twitter saying, oh, Charlie, I'm doing research. I'm going into every sector to make sure that everything is in line. And how did they do everything after all his research? They missed the part of the nurses. They missed the part of the nurses. See, we have to listen to the part of the nurses and listen to the government. Judge this on a scale that will fit everybody. Don't go after one and leave one. No, it's not done like that. People are saying the nurses are over pampered in this country. I'm like, how, bro?
Oh, Johnny Hughes is not being fair. He's misinformed. I'm not misinformed. I am saying to you that nurses have been over pampered in this country. We travel around the world. We know what nurses do. Patients have rights. You signed on to the rights that patients have. Was this what Florence Nightingale was doing?
Do you know the statistics of the number of nurses who are leaving this country each and every year? They are looking for greener pastures, and you are saying that they are over pampered in this country. For real? For real? The thing is serious. People are dying, bro. People are dying.
Workers at Kolebu Teaching Hospital. And then my uncle had a serious asthma attack. He was struggling not from Nana or but because you people are on strike, you refuse to even take care of him. Even after his wife was demanding, say, she's going to pay every amount. Ye profession, we are all humans. So, a young man at the age of 30 years, he married just 3 years ago. 3 years ago, so yeah, this December will be 3 years. He doesn't have a kid. He had an asthma attack. I catch on the say, you guys are on strike into unfan and co. Yeah, Damasi, he's dead. Yeah, the not question much. Yeah, Damasi, we are grateful to you people. See your profession soon chair, Mumayan Kaisi and any pow. And you money and I be. Now, so we are some men show your when
there are two parts to this conversation here. The part of the nurses. The nurses are demanding for some things.
In case you don't know the reason why we are on strike, we are not asking for too much from the government. And you can see how possible say nurse in your area no hospital Treska. Maybe na me area we know. Me are when insurance say what. Na say me say maso to me as you bodon do. Oh maso na me say okay. My main cause yes special request na me go almost insurance. Na yet sure a music clap ne a debe year drop mommy. Make a 236 something, like seriously. And wait, baby, and then we can see you see a buying and taking care of our medical bills. Is that one too much to ask?
What the nurses are demanding for it, government, we have sat down to talk about certain things. Follow up to that condition. Make sure you fulfill those things because we have sat time and time again on the negotiation tables, negotiating. How can we do this so that it will fit everybody? And you have agreed to do it like this. So let's move up to the conditions that we have set together. That is all they are demanding for. Okay, what is making this thing serious? What is making it difficult for the government to solve right now is that the nurses are saying they are not ready to sit down, for any negotiations any longer because they have sat down to negotiate a lot of time. So if the government want them to sit once again then it must be for implementations, not for negotiations.
We are ready to go to the implementation table, not negotiation table. I've told you that we have finished with negotiations. These two words are not the same. It must not be used interchangeably.
Now, the government is saying what the nurses are demanding for. It is a lot. If they will meet up to the conditions, what the nurses are demanding for everybody to have what they want and everything will settle for them to go back to work, they will spend about 2 billion Ghana cedis. That's what they are saying.
But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cities to the compensation budget.
So right now, what they can do is to sit down and negotiate and see how they can put this on a good scale so that it will work for everybody. It will work for the government and it will work for the nurses. But the nurses said they are not ready to sit anymore because the government have made them sit time and time again for negotiation and they have not. Until when you now, I don't really know what to say because I mean people are making. They said they are saying all these things started back in Adodi's government. Me, that one stuff no they concern me. What they concern me right there, say people they die. So make them talk about these things and make sure they resolve the problem once and for all. Like people go give birth through CS and they are back in hospital for checkup and nurses are not there to work. I'm like, how?
About 1 week, wow, remember review. Why I'm serious, I don't get number my doctor Shemuku, nurses will be on your house. Overcheck him about us, my doctors, theatre, everybody will be hours to work for.
It is mind blowing. Somebody's uncle died because the nurses have refused to take care of the person. So the government should make sure that they put things in order so that everybody see. It's not all the nurses who wants to go on the strike. For real, it's not all of them who wants to go on strike because some of them are not working as nurses only for money. They are working as nurses because they have love for humanity. They want to take care of people. They want to help humanity. But this is an association. Only you cannot demarcate yourself that okay, let them go on strike. Only me alone, I'll come and work. No, it doesn't work like that. There are due processes to this thing. So the government should just see. I don't know what to say anymore. I want to see your thoughts in the comment section. Do you think what the nurses are doing is unreasonable? Do you think nurses are overpaid in this country? Do you think what the government is doing is irreasonable? Because the fact that they are calling registered nurses to come and help, that is what is getting me mad, bro. For real? For real? Nurses have gone through shits in this country. Some of them are retired and they are going through a lot.
And I've been told that one of the mitigating factors is to deploy retired nurses and midwives. They are more even angry than us. What they don't know is that the retired nurses and midwives feel that they've been let down by the state. Okay, I visit them from time to time, not just individuals, but if
Nurses are the challenge. Too much. Let me see your thoughts in the comment section. What do you think about this whole thing? Because it's getting serious. People are really dying. The name is Alex Papi K. I'm out.